the room? Yeah. Asmita and others, shall we start the meeting?
Yes, ma'am, please.
Good morning and good evening. It's my pleasure to invite you all to this webinar on epilepsy and seizures, building care in the community. This is a topic that is not only clinically important, but also a public health priority. We know that epilepsy affects around 50 million people worldwide, with almost 1 in 5 we have living in India. Yet, despite the availability of effective treatment, large treatment gaps still exist, and it is particularly more seen in the rural and the underserved communities. The barriers are not just medical. They include the stigma, the lack of awareness. There are so many myths around the disease. And there is also a shortage of trained healthcare professionals, and there is also a limited access to essential anti-seizure medications. So building care in the community means moving behind the hospital walls. It means empowering primary care physicians, we call the PHC doctors, the nurses, the community health workers, teachers, patients, their caregivers, families with the knowledge and confidence to recognize seizures, how to do and provide a first aid when the person has a seizure, intimating and timely referrals for the physicians to the tertiary care center, and to have also a comprehensive long-term care. It means that there should be a system that is accessible, affordable, and compassionate. And now today's discussion is an opportunity to explore practical strategies. We have three eminent persons with us for making epilepsy care more inclusive and ensuring that no person with epilepsy is left behind simply because of where they live. We have Aditi Malhotra, Amy Hill, and Todd Taylor. They all are working at the Hesperian Health Guides. Aditi is a staff writer, researcher, and a global health advocate at Hesperian Health Guides, and she's best known and the co-author for the comprehensive medical resource, Epilepsy and Seizures, Building Care in the Community. This is what we're going to talk on. Her work is basically focusing on building community health systems, dismantling healthcare stigmas, and providing accessible educational resource in low resource settings. And one should look at the book, and I'm sure that she's going to touch on that as well. Amy Hell is the editorial director at the Hesperian Health Guides and the founding director of Silent Speaks Storytelling, based in California. She's globally recognized trainer, consultant, and educator who is specializing in participatory media and ethics of personal storytelling. Welcome, Aditi and Amy. Todd Jala is an author, editor, and publication director for the Hesperian Health Guides, an organization, again, which is based in all three of them, that creates accessible, again, community-focused health materials. One should go and have a look at the Hesperian Health Guides. He has been a key figure in writing and directing guides that empower workers and communities to take control of their health. So we look forward to hearing from you as to how epilepsy and seizures can be taken out of the hospitals and it can build care in the community. Welcome, all three of you. I will invite Aditi to give her first talk.
Thank you so much, Bindu, and good morning from California, everyone who's gathered here. And thank you also to Asmita for organizing the logistics behind this webinar, and for Todd and Amy for joining this morning too for this presentation. So yeah, I'm very excited. We're all very excited to share with you about our new health guide. It's called Epilepsy and Seizures, Building Care in the Community. And I would like to share a presentation, and it will go through each of our segments. So hang in there while I share screen. Just gonna set this to slideshow mode. All right. Yeah, so what you see on your screen is our new book, or the cover of our new book on epilepsy and seizures, like I said, and you can see on the vibrant purple cover page of this book. It's titled Epilepsy and Seizures, Building Care in the Community. And we're a nonprofit publisher based here in California named Hesperian Health Guides. And we've been working on developing and published this book recently, actually in April this year. And I will tell you more about the organization, and you'll hear everything about the project over the next hour or so. Bindu already gave an introduction for myself, so I'm going to skip that and share with you all the three things that I'm going to highlight in my presentation. So I want to talk about why at the outset we knew and were endorsed through our research that a book about epilepsy from a community care and social justice perspective is the need of the hour. I'll also share what the target audience for our book is. I know through the IAN service, many of you who are gathered here work as neurologists and healthcare providers in the field. But the audience for this book goes beyond that, and I just want to take a moment during my presentation to highlight that as well. And I will introduce some of the topics that are in the book and share a little bit about how they may be valuable to your work on epilepsy care in India. Before I dive in, and I missed one gratitude note, big thanks to IAN for hosting this webinar and for inviting us to share more about the book. So, why this book was developed? At the outset, it's important for me to share that this book is a health education tool. It directly addresses a global gap in simply written, reader friendly health information about epilepsy and seizures. And while health education materials on epilepsy for a general audience do exist, and shout out to many of them actually from different parts of the world, including India and South Asia, that helped shape our research and contributed to our understanding of the topic. Many of them respectfully fall short on one front. We saw, and you may agree, that there is an unrealistic assumption in texts and guidebooks about epilepsy and seizures about the resources that people in different parts of the world have access to. What do I mean when I say resources? I'm thinking about adequate medical care, about safe neighborhoods, about education, food security, social and emotional support at the community level, all of which we believe contribute to a person's treatment plan. Many of the resources we found when we started building the groundwork for this book 5 years ago, actually, are also in English. And so is this book, but it's written with a keen eye for translation. And Amy will touch upon that in her segment when we arrive at it. But we noticed that many of the resources are in English, and there is truly a dearth of material in local languages, and we'd all agree that our local languages are what we use to communicate about our health, about our bodies, and our minds. So, here at Hesperian, we have been developing popular education materials on a variety of health topics for the last 50 years, actually. And we wanted to develop the same for epilepsy. We wanted to develop material that could speak to people with or without medical training. And more importantly, speak to people about building a foundation and a spirit of community care and education for epilepsy. Epilepsy and Seizures Building Care in the Community, the title of our book. This book offers clear, accurate information about epilepsy. And sure, we touch upon its medical and physical effects, but we're also keenly discussing in the book the social, emotional effects that living with epilepsy has on individuals and communities. This is aligned, as many of you are aware, on the global with the global movement and focus on community education to bridge the epilepsy treatment gap. The audience for this book includes and is not limited to people with epilepsy, their families, health advocates, clinicians, teachers and students, policymakers, and other stakeholders at the community level who want grounded, community informed perspectives about care for epilepsy and seizures. Again, this book is a guidebook, it is a manual prompting community action around epilepsy. This slide talks a little bit about how this book was developed, and I'll touch upon points 1 and 2. And Amy, in her segment, will actually talk about our work with partners across the world and user testing and how that panned out. So when we started this book out, it wasn't it was none of us are experts on epilepsy, but it was an effort to lay a strong foundation and groundwork for this material. And that involved, like I said, gathering and studying existing research and educational materials of a variety. We read books, we analyzed and read published research, guidebooks in different languages that many people in different parts of the world helped us translate to as we were trying to read and research around them. Global institutional documents around epilepsy, and there's been a plethora of this over the last couple decades, among other types of research. And in the very early stages of content creation, and this was the exciting part for me, was that we were already keenly building close collaboration with epilepsy experts who represent our target audience. So there was an effort and an earnest sort of outreach to bring people who were already working in epilepsy care and community action in different parts of the world into the fold of this project and interview them, ask them for different inquiries. There were sort of people who helped us find things, people who helped us read between the lines. So there was an effort to build a network of partners around the project from the outset. Once we felt that we had enough information, both by way of research as well as reporting on a topic, we started writing draft chapters to an outline out. And all draft chapters went through rigorous internal editing and review before they were ready for external feedback. Here at Hesperian, we are a team of about five core editors and many other staff who've been involved in development and publication of health education materials. And everyone was involved in reading the chapters and offering strict as well as honest feedback on each of them. And that was the process that we took on initially to review what we were writing and building for this book. And like I said, Amy will touch a little bit more upon how this is not just our work, it is the work of a global community. And the partners and the partnership model, the collaborative editorial model around this book is very exciting. And I'd love for you to stay tuned to hear more about it. Next, I'd like to introduce some of the topics in the book. So, the book is a 9 chapter book, and it covers topics ranging from seizure first aid to types of seizures, how to identify them. We also write about anti seizure medicines and different aspects of medicines for epilepsy. The second half of the book looks more at the socio emotional and cultural aspects of living with epilepsy. We have a chapter on talking to children, we have a chapter on stigma, living well with epilepsy. These 2 pages that you see on your screen right now are from chapter 2, How to Help a Person Having a Seizure. And I wanted to say that. This is something that actually extensively came up in our interviews, a little highlight for how this might be helpful to your work. The chapter, among other things, talks about video documentation for clinical diagnosis. When I was researching and reporting material out in India, this came up actually in a big way, in extensively in conversations and interviews. The chapter recommends that bystanders take videos of seizures, showing the whole body, not just the head, recording sounds and continue to record the person until they have recovered fully. And neurologists have told us that this type of information is clinically valuable. Like video footage of a seizure in the natural environment can help distinguish seizure types, identify the patterns of movements and behaviors, and differentiate between seizures from epilepsy and non epilepsy events, all of which, as you all know, inform diagnosis and treatment. So, that page number 18 that I show you on the left hand side is about taking videos, one of the several things that we cover in this topic. And as you can see, illustrations are also a core and integral part of each of the pages in this book. In this chapter, we've also been intentional about documenting harmful folk remedies that we know from our research and reporting are still practiced in several communities across the world. This is page 19 and in the book that addresses that. So, what not to do during a seizure: putting objects in the mouth, rubbing metal on a person's hands, covering them with blankets to trap the spirit, or making them smell onions. We explicitly state that seizures are not caused by spirits, curses, or demons. And I believe this is helpful for neurologists who work with diverse populations and sometimes need to be learning about the different type of myths as they train themselves, as well as educate people who have epilepsy and their caregivers around, like I said, what not to do and what we can stop doing to wean certain ideas about treating or stopping seizures. The chapter, as you saw on the previous slide, this right-hand side page on after the seizure also describes normal post-ictal symptoms, confusion, drowsiness, nausea, headache, and how to distinguish what is an emergency and what is not. Moving along to another chapter that I wanted to highlight. This is chapter 6 in the book, Living Well with Epilepsy, one of my favorites. In this chapter, we include not just information that we gathered, but we're actually using stories, like real life stories, as a way to share with people in the voices of people who have epilepsy what their experience is like living with epilepsy. People with epilepsy consistently report, that the non-medical dimensions of their condition, the fear of seizures in public, social withdrawal, restrictions on activity, all of this actually affect their quality of life. And we wanted to make sure that the book addresses that. We talk about that. We talk about that not just from the lens of how people experience this, of what can we do at a community level to make this better for people who live with epilepsy, their families, but honestly, everyone, because all of us are living with each other, right? Like at the so grassroots change, like that's what we were hoping to highlight in the book. So on the left-hand side, you can see that we included information about swimming with epilepsy as one of the topics. So we talk about, how that impacts people and jump then into what are some of the safety tips that people can apply, when they are recommending this practice, but also like people with epilepsy who choose to swim, like what are some of the safety tips that can come handy. And right below that, you see that there's a story about Kwame who fights his fear for swimming by swimming. So just to give you a sense of how these different techniques are jiving in the book, again, plenty illustrations, plenty actionable tips, and also complete with stories that highlight the lived experience. These are two other stories that we included on the right-hand side in Living Well with Epilepsy. We wrote about the experience of Vinay Jani, who many of you may have heard of. He's a person living with epilepsy turned epilepsy advocate. He lives in New Delhi and really has embraced cycling and fitness to not just take care of himself and his body, but also break barriers and stigma around limiting physical activity when one has epilepsy. On the left-hand side, Bright Bawalia from Zambia, who's another person living with epilepsy, spoke to us about how cooking makes him feel bright in low moments and how he incorporates this into his life despite, the unpredictability and uncertainty of seizures that come with his epilepsy. I also wanted to highlight a chapter that we took on as, kind of an ambitious play because we wanted to write about stigma, but also wanted to write about it in a way that resonates with people. So, a short note about this chapter. Our coverage and chapter on stigma, we've titled it Taking Action Against Epilepsy Stigma, is doing something quite ambitious. We are trying to make stigma legible and actionable to people who may be living inside it, often without the language or framework to name what is happening to them. We do this by breaking stigma into three distinct but interconnected pieces of the puzzle, actually inspired by the work of the International Bureau for Epilepsy, which has been doing tons of work to dismantle and raise community action around stigma in several parts of the world. So we chose to sort of like piggyback on their descriptions in close collaborations with them, but also then showing not just through theory but through story how different types of stigma play out at the community level and affect one's life and also family lives. What makes this chapter distinctive, I think, is that it doesn't treat stigma as simply an attitude problem, but something that can be corrected through health information and through grassroots activism. It shows stigma as a system with real material consequences. Children get pulled out from school. There's a story in the stigma chapter where we show how that is happening to a child named Amani. And then we demonstrate that change requires action at every level. So I'd love for you to take a look at these topics in the book. This is a slide that I wanted to leave here so that you all have an idea about our organization, Hesperian Health Guides. I can share a little bit about us before I pass on the spotlight to my co-author, Todd Jaylor. So Hesperian, we've been around for more than 50 years and we've been providing information and educational tools to equip individuals and community organizations to take greater control over their health and lives and mobilize to eliminate the underlying causes of poor health. As you can see on the slide, we have over 300 resources in 85 languages that have been in use in 221 countries and territories across the world. We have a very strong network of translation partners, and our books are available in different languages, including English. But you'll see on our website, that there's plenty of Indian languages that several of our materials are translated into, and hopefully, epilepsy will also see that type of vibrant translation work into the several languages that people in India speak. Our materials, just to highlight, are available as books on our unique Health Wiki search platform that's on our website, www.hesperian.org. You don't need to buy material or purchase all the time. Many of our materials are available as free to download PDFs. And we also have smartphone applications, which any of you are interested, we can talk to you more about that. They focus on reproductive and maternal health and are very popular tools used by health workers and promoters in different parts of the world to raise awareness about reproductive and maternal health. So with that short introduction to Hesperian, I'll close out my segment and have Todd continue to share more about the epilepsy book. Todd, over to you now.
Thank you so much, Aditi, and thanks to everyone who's with us today for the invitation to come and speak. We're really quite honored by that. I'm going to briefly discuss some of the more technical or medical content that you might find in the book. As neurologists and epilepsy experts, you probably think, I don't need that. And my goal is to convince you that, in fact, you do. So let me sketch out a little bit about what you can find, particularly in Chapter 3, types of seizures, in the chapter on medicines, and in the chapter on pregnancy and birth. You are all too familiar with the medical language used to describe epilepsy and understand how it can be difficult for someone who's not trained in your medical specialty areas of epileptology and neurology. Thanks for the slide. Unfortunately, few health workers have received the training that you have, which can make getting help for people with epilepsy quite difficult. It also can make being helpful difficult for those inadequately trained health workers that people first approach to find support. Epilepsy and neurology are not topics that are well covered in most doctors' education, and they're often completely absent in training for nurses and other frontline health workers. So we've tried to make this kind of complex information on epilepsy and seizures accessible both to people seeking help as well as to the health workers who serve them. Since you probably don't have the time to provide a complete course on epilepsy for your coworkers who did not receive or provided only limited information in their training, we think you'll find the material in the book helpful to recommend to them. As neurologists, you may also find it helpful to use the common everyday language in the book to talk about epilepsy and seizures, to make it easier for people to understand, for patients and for coworkers as well. So in the book, we offer basic guidelines for diagnosing epilepsy through the various types of seizures that people have. So you see the box on the right-hand side there of tonic seizures. Chapter 3 contains 10 different boxes about different types of seizures, like this one. Each box summarizes what the seizure looks like, its possible causes, and possible treatments. By itself, this information is certainly not enough to make a diagnosis, but for people with epilepsy or family members, it can provide a starting place to begin discussing how they can get help. For health workers who don't regularly deal with epilepsy, these summary boxes can serve as a starting place or a reminder regarding each seizure's signs, causes, and treatments. During our research and writing, epilepsy practitioners shared with us information about aspects of seizures that are confusing or cause mistakes in identifying the type of epilepsy that a person has. So some of that material is included as well. As you all know, diagnosing epilepsy is something learned through experience as much of an art as it is a science. So for the next slide, please. We also include in Chapter 3 a discussion of psychogenic seizures, seizures that are not caused by physical conditions like epilepsy or by injuries or infections, but seizures that have psychological causes. There's a very helpful chart on the differences between seizures caused by epilepsy and those with psychological causes. Again, many medical professionals receive little training in psychology, and too often people presenting with seizures are just assumed to have epilepsy. If they're treated with anti-seizure medications, which do not stop the seizures, it's really not the fault of the practitioner. Too many caregivers are so overworked and overscheduled that it's impossible to spend the amount of time necessary with each patient. Our medical systems need better funding so they can be better staffed and better meet people's needs. Given that my country's government spends more money on war and the military than any other country in the world, I feel compelled to say that our resources would be so much better spent on people's health needs than on death and destruction. But that is another discussion. The next slide, please, will show, yes, information about medicines. Most of the Chapter 4 information about medicines, when to take them, how to divide doses to keep levels in the body more constant, what to do if you miss a dose, can be shared directly with patients. We've gathered examples of easy to understand dosing forms, ways to help someone remember to take a dose, how to divide doses if that's necessary. Many practitioners have shared the tools that they use with patients. We think you will find that useful. The book provides descriptions of child and adult dosing information for 15 common anti-seizure medicines. Next slide, please. This shows the information for carbamazepine. We don't expect that people with epilepsy will use the information to dose themselves or to change their doses. The book counsels against that. But we do think that people have the right to know this information, and that knowing more about their medicines and doses lets people participate more in their treatment, and it improves communication with health workers. For neurologists, this information can serve as a reminder about important aspects of anti-seizure medicines, so you can make sure that you cover this information in your communication with patients. Next slide, please. We also include a section on common side effects of anti-seizure medicines and discussions of when side effects are dangerous and when they're just annoying. Given that side effects are a major reason why people stop taking anti-seizure medicines or don't take them regularly, this is truly important information for clinicians to share with their patients. Patient education can prevent what, from a clinical perspective, is just non-compliance, but from a patient perspective, may be trying to navigate what they find to be an impossible set of situations. We also include information on drug interactions, how anti-seizure medicines can affect birth control, and how some drugs affect how the body processes specific vitamins and minerals. Thank you. The medicine information highlights the effects that anti-seizure medicines can have on people who are pregnant or who want to be pregnant and breastfeeding. As you know, some medicines aren't safe for mother or baby, so we explain how to evaluate the relative safety of anti-seizure medicines, how to safely change medicines if that becomes necessary and is possible. We use a set of symbols you'll see on the bottom of the slide there to show when there are concerns with a medicine for people who are pregnant or breastfeeding. The symbols are in all the medicine boxes, like we showed for carbamazepine, and provide a quick visual reminder that there are issues that you would like to discuss with your patients. The next slide, please. Chapter 7 on pregnancy and birth covers a broad variety of issues, including but not limited to medicines that people with epilepsy may experience as they build their families. This information can help neurologists work as a better team member with the obstetrician or the midwife who will guide their person through pregnancy. You know, one of the reasons we're so honored to be here today is that we were incredibly impressed by the work of Dr. Bindu and Neurology on Wheels, which we describe in the book. Your method, of how to bring previously inaccessible care directly to communities. And in some ways, their work reminded me of another quite different set of partners we've worked with, including the Aravind Eye Hospital in Tamil Nadu, who provide eye care, cataract surgery, eyeglasses, glaucoma, et cetera, to long neglected rural areas. We worked with them and with other partners to develop a book or a pamphlet on eye care, which they have recently adapted to use in their training program for health workers, some of whom work in hospitals and in surrounding clinics, and others who live and work in more rural areas, and provide a kind of continuity of services in between the visits of the ophthalmologists out to communities. Another one of our partners, Seva, then helped produce an edition in Spanish, which they use in their outreach work in Latin America, which is the book cover that you see on the screen. This is the kind of information and resource sharing that Hesperian is best known for. We would love to see neurologists use this book on epilepsy and seizures in a similar way, to adapt it so that your networks of health workers can use it to raise communities' level of understanding about epilepsy, and to train others to assist people with epilepsy who seek help in between the visits of highly trained neurologists. And of course, any information that is translated or produced in the languages that people speak will be the most helpful to them. So to sum up, we hope that neurologists will use this book as a source of basic, easy to understand information on epilepsy to share with patients, as well as to share with broader networks of health workers with whom you interact, with doctors, nurses, midwives, pharmacists, and health promoters. It can help practitioners find common language explanations about epilepsy instead of relying on medical jargon. It can promote patient understanding, which is the key to successful treatment. And as my co-author Aditi discussed earlier, it situates all that technical information in the context of people's lives, in their living conditions and social relationships, because that's how people with epilepsy experience their epilepsy. So again, thank you so much for your invitation to speak together, and we look forward to answering any questions you might have. And I think Amy next will talk a little bit about how we work with other groups and organizations, especially around translation and helping information get out to people who need it. Thanks.
Thank you so much, Todd and Aditi, for that really excellent overview of our new book on epilepsy and seizures. And thank you again to Bindu and IAN for hosting us today. As Todd said, we really are very honored to be here. So now that you have learned about the contents of the book, I wanted to just share some information about how you can get a hold of it. If you're interested in a print copy or a full PDF of the book, you can order these online from our Hesperian store. If you're interested in individual chapter PDFs or in accessing specific content within chapters, you can find those through Hesperian's Health Wiki, which Aditi had mentioned. This is a searchable repository of accurate health information that includes the contents of our print books and more. And so the links for these various options are noted on the slide here, and we'll certainly send out a follow-up email with all of this information. So I wanted to just take a moment to talk about how this book was developed in partnership with people and organizations. So I think we can go to the next slide. As Aditi had said previously, we did do quite a bit of groundwork, gathering and studying existing research and so on. And even at this very early stage of content creation, we were already beginning to build close collaboration with a range of epilepsy experts who represent our audience from all across the world. So that includes people with epilepsy, of course, their caregivers and family members, and then health workers across the whole spectrum of professions, from neurologists and epileptologists to nurses, health educators, and community health advocates. And so, just to say again, the book is really not just the work of the co-authors and our wonderful editorial team at Hesperian. It's the result of what has been a very long-standing and wonderful model of collaborative editorial work that solicits extensive input and review of material from diverse networks of grassroots organizations, partners, and experts who shared stories from their own lives and from their work on epilepsy in a variety of settings, and who helped ensure the material is realistic and usable in homes and communities, schools, clinics, hospitals, and more. So I wanted to just give a quick spotlight of some of our partners. I think we can go to the next slide. These next several slides give a glimpse of some of our partners to just give put a little visual to what we're talking about in regions around the world. So of course, the International League Against Epilepsy, which is ILAE, as you all know, and the International Bureau for Epilepsy, IBE, were really very generous in facilitating connections for us globally. And in India, we collaborated with, among other organizations, with Saman Association, Epilepsy Foundation of India, the Stop Epilepsy India Research Project, which some of you may be familiar with, and then, of course, with Bindu on the story about neurology on wheels. In Hong Kong, we partnered with the Hong Kong Epilepsy Association. And then also back in India, Aditi was fortunate enough to attend ILAE's Asia Congress last year and connect with other groups in the region. In Latin America, which I think is the next slide, yes, we were really fortunate enough to have a connection through IBE with the Colombian chapter of IBE. The colleague there prepared some of our draft chapters in Spanish and facilitated in-person focus groups and coordinated review by colleagues in Ecuador, El Salvador, Paraguay, and Venezuela. We also had input and collaboration with Espacio Epilepsia in Argentina. So some wonderful connections with Spanish language groups there in Latin America. And then finally, across Africa, which I see Aditi is bending down, but there, we go to the next slide. Okay. We worked with individuals and groups in 9 different countries, including Kenya, Ghana, Lesotho, Malawi, South Africa, Tanzania, Uganda, Zambia, and Zimbabwe. And some of the review sessions, because it's such a big geographic region, some sessions were conducted through online connections, and some were conducted in person with recordings and notes shared with us. And so these are just a few photos from some of those sessions. And the photo there on the lower, my lower left is from one of our partners in Uganda, Purple Bench, not actually from the review session, but shows their delight upon receiving the package of books that we sent them. All right, so those are some of our partners. If people are interested in learning more, please feel free to reach out to us. There's lots of interesting insights we can share about how they supported development of specific content with their review and ideas and so on. So I think we can go to the next slide. I wanted to talk briefly about translation at this point. Hesperian develops our resources initially in English, but we are really committed as an organization to getting materials into as many languages as possible. And to this end, we have an active network of translation partners with whom we work on varying projects to translate chapters of books, entire books, as well as the reproductive health apps, which Aditi had mentioned. And for epilepsy, we are currently seeking resources to support translation of selected chapters and also the entire book. We already have leads for translation into some South Asian languages, but we would be so grateful to anyone who can make additional connections to us to support translation into as many South Asian languages as possible. Again, as Aditi had mentioned at the beginning of the session, there is such a crucial need for accessible and user-friendly resources in the languages that people actually speak. And so we want to keep the momentum going around that, and we'll definitely keep everyone posted as to how that evolves. So I think that is the end of our slides portion, and we have another few minutes at the end of this session where we'd like to transition to a Q&A. Again, the resource is meant to be adapted for use by people with epilepsy, family members and caregivers, community advocates, clinicians, policymakers, and so we really hope you'll utilize it yourselves and share it across your many networks. So for the Q&A, I think you can note questions in a Q&A somewhere box or a chat, and we'll do our best to answer what we can. Yes, okay, so Aditi has said, please note your questions in the Q&A box. And we wanted to kick off by returning to Bindu, who helped put the session together. So Bindu, we wanted to hear from you based on the amazing grassroots clinic to village operation you've been running with Neurology on Wheels in rural India. How do you think that clinicians working in primary care settings particularly in remote places with scarce resources can use a book like this one?
Thank you first, Aditi, Amy, and Todd for taking us through the journey of making this wonderful book and getting it out in print and having a resource equally important for patients, caregivers, as also for clinicians, where they can translate into a very probably a patient-friendly language. So this book is a practical resource, I would say, which can be adopted for any community education and healthcare worker training. Healthcare worker training primarily because when we go out for train the trainers program, who already have a grassroots level of knowledge, but then they need to upgrade and skill themselves in communicating to the patients and the caregivers, as also to the other general public as to how should one do a first aid, as has been promptly written there. What are the do's and don'ts? We keep speaking it out in various of our sessions, but then it has got its own lacuna because it's not concise, precise, and probably it's not compiled in one form, and we might tend to lose certain facts of it. And when it is in a book format, but the only thing is, in my place, or in any other remote place, it definitely needs a translation. Only I can just reach out to them and show them the pictures, which I also find that is a very big indicator of the book being of extreme use because of the pictures that are very beautifully highlighted there. I think it will standardize our message and it would improve the confidence for managing the epilepsy closer to home, because they know about, as Todd has rightly said, they know about the medications. We are not asking them to make changes of the medication, but then we want them to precisely know how the medication can be used.
Wonderful. Thank you so much for that. So to people on the call, please do feel free to pose any questions in the chat box. Again, for Bindu, we know that you do use storytelling, and you've just referenced some of the wonderful illustrations in the book, which we also love. The book does contain many stories from people with epilepsy, which Aditi had also highlighted in her portion. And so we'd love to hear you talk a little bit about what makes stories and so effective, particularly in the support group oriented work that you do, how you've found them to be helpful in supporting people.
I particularly find that storytelling is absolutely important when we are trying to convey a message, particularly when it revolves around the myths and the misconceptions. Because if we have a live and a lived experience, and the person's experience, if we are sharing, there are certain in the crowds, many members in the crowd, as also in the community, who have faced extreme situations of similar nature, but then they do not have the confidence to come out and speak out. When they find that there is somebody yonder, nearer, many more people who are having the same sort of challenges which they are also particularly facing, then they've become, I would feel that they become more confident that this is an issue which can be addressed if it is spoken out, if it is shared, if it is translated into a way of care into the whole treatment program. So most of the times we take out one person's experience and sort of share that this person had this and the person went and did this. He went to a quack, he did this treatment and he had this issue. You can inevitably see that people are looking at each other and nodding and trying to understand that, yes, this did happen. Didn't it happen a little bit? Did it not touch this sort of problem sort of near, or did I not escape from this problem? You can see all the emotions, and I find that's very important, and I can see that the pictorial representation, I'm really delighted to see those, because it really is a connect to anybody who's going to read the book.
Wonderful. Thank you so much. And I will just say our colleagues and partners in Zambia were especially taken with the stories and anecdotes in the chapter on stigma, which has a big section on how support groups can help challenge epilepsy stigma. And in fact, they then went on to start an epilepsy support group as a result of being involved with that review process. So that was really heartening for us. And I'm happy to hear that, that the stories are useful in your work. So as we move towards the end of the webinar, I think I'll just ask you one. Oh,
okay. So yeah, I just had this question about the book. I see that it's really special because it has emerged from lived experiences, and it's a collection of medical facts and sort of guideline of how somebody can go capturing the voices. I'm just wondering whether this book is primarily intended for low and middle income countries, or has this book also go on to address the community care in the higher income countries, the community care challenges they might have? Or it is just we are trying to focus on the LMICs and the problems there?
yeah, thank you so much for that question. I think I'll turn it over to Aditi and Todd to address.
Yeah, thank you so much. I think that's a great question, and I can share that from a research and reporting standpoint, definitely the focus was on three global regions. We were very focused on developing partnerships and seeking contributors from different parts of Asia, Latin America, as well as Sub-Saharan Africa. However, during the course of producing the material and learning more about epilepsy ourselves, many of the challenges are universal, no matter what part of the world you're in. There's a clear need for community care and grassroots level change and activism here in the US as well. There's many parts of Canada where we heard from people about the need for materials in remote parts. And there's topics in the book which are universal. So they cut through the borders and the boundaries and income and socioeconomic contexts of people. There's a chapter on talking with children about epilepsy, that provides age-appropriate guides, supporting communication around epilepsy, which I think is an incredible example of anyone in any part of the world with varied levels, literacy levels, can pick it up and read it, learn from it, share feedback on it, maybe apply their own experience to it. So I would say that while the focus is low and middle income countries, there's definitely topics, and that's just the nature of the health condition that cuts through borders and is universally and globally applicable. Todd, do you agree?
Yeah, I think that it's it's a sign that stigma, unfortunately, pays very little attention to a person's social class. I mean, it does. It gets amplified regarding issues of gender. Stigma is much stronger against women. I mean, it's a bigger issue for women with epilepsy oftentimes than it is for men. And it doesn't matter sort of whether they're from a high income country or a low income country. It's just the difference between the two, or between high income countries and low income countries, is mostly around access to medicines. And access is a big issue even in high income countries like the US, where everything is mediated through insurance. So you can live in the shadow of the largest hospital, in your state or region, and still be unable to get through the door if you don't have appropriate insurance or ability to access care. So this is, I think, useful pretty much all over the world.
Or that's what our hope is anyway, that, people all over the world benefit from it. And yeah, I'd love to hear more questions from the audience that's gathered here.
So, I'm sorry, you were asking something while I cut across and asked this question. And I have Dr. Vengama lifting a hand. Asmita, do we have the facility to?
Yes.
Yeah. So while that's being done, was there something you were trying to ask?
Well, while we're waiting for this question, I just was wanting to ask you another question about if you had any specific advice to other neurologists, since that's our audience for this session, who are really interested in doing that work of building local capacity for epilepsy care, particularly in under-resourced areas.
Yeah, I think, yes. Actually, the advice should be to start small, but think sustainably. So that's how our foundation has also, it started very small, and tomorrow we are going for my team. They're going to come along with me. And it's also very important, as the book also rightly shows, it's a partnership. You have taken a lived experience from across the world, so we know how the epilepsy affects each particular individual and how it is different. So building partnership with primary care physicians, nursing, community health workers, patients, families, caregivers, organizations. And I think it's the best way is to keep building and networking and focusing on education and mentorship. Providing care is one thing most physicians commonly do, but then I think we should step out of our hospitals and then also see that we educate and mentor patients and caregivers. It's just not mentoring for academic reasons, but mentoring patients and caregivers. I think that's one way that we can do. If I feel communities being empowered, is the impact goes much more. It's a partnership all the way through. Yeah. Thank you for
Wonderful.
that. Thank you for bringing up that. I think, Dr. Vengamma, you can unmute yourself and you have been given the rights. You can ask your question, please. You may need to unmute yourself. Okay. I
In your
suppose.
Dr. Bindu, it
Yes,
was
yeah.
nice, and initial part of it I missed. Whatever I wanted to tell, I think you summarized. It's good. I just wanted to say thank you.
Thank you so much, ma'am. Thank you for your comments and coming for the webinar. So there are no more queries. I suppose it was wonderful to have Aditi, Ami, Todd, all three of you, and for the wonderful work that you have been doing behind the screens, bringing out such exquisitive and so much of informative information from grassroots level, from patient voices, from community voices into print. And that's something which all of us probably should also look into it, have a peep into all the books. I would want that everybody should look into that book because it's very simply written, but very effectively driven. So I suppose, and there are lived experiences. Vinay has come here, and he's also an ambassador for epilepsy. Thank you very much. And I appreciate that all of you should go ahead and read the book. And if possible, I would encourage somebody who could come and probably make a translation of at least some chapters that we can translate into our rural communities. Thank you very much. Thank you to all the participants for coming on this evening, and have a wonderful weekend ahead. Thank you so much.
Thank you so much. Thank you.
Bye-bye.